Hey, good afternoon, everybody. It's February 17th. We're in midweek of this week here, and it's still somewhat cool out there. I maybe got up to 25 right now, so I feel like we're out in California. No, I won't talk about California. I've been out there a few times. So anyway, we have a special guest with us today, State Representative Barbara Hernandez from the 83rd District. That's represents the Aurora area, Aurora. And we're going to try to touch base on COVID-19 vaccinations and other things along that line with Representative Hernandez. I know she's got a lot on her plate here. I'm happy that you could take some time to be this afternoon with us. So, hello, Representative Hernandez. Thank you for joining us here.
Hi, thank you so much for having me. I'm excited to have this conversation with you.
Well, thank you very, very much. The 83rd District, does that cover basically all Aurora or not? What area does that cover about?
So I cover the most of Aurora. There are some representatives that cover smaller portions of Aurora, but I do have the most of it. I also cover parts of North Aurora and a little bit of Montgomery as well.
Okay, you go up to I'm actually up in Batavia, so you go up to Butterfield Road about or something like that, right?
Yes.
Yeah, so you cover a pretty good area. How many constituents do each rep have about? What's the number on that? And that is it
I
100,000 or
think
how?
it, yeah, I think it's 100,000. And of course, with the census, we'll see what's the next numbers that we have that are going to be new compared to the 2010.
Yeah, I know. Everything's can change here, these boundaries, and yeah. So that's out there. Um, I don't. I'm older, Barbara. You're a youngin, and I'm an oldie, and I'm in quote the 1B group of these vaccinations. It includes a lot of people, but it's for my age that I'm in that group, I believe, and. And I've been looking at the websites and the county website, and there's been a lot of articles on this the last few days. I I'll be honest with you, I think it's going pretty slow here, and I've not had too much good luck with these pharmacies right now in my area. I don't know. I'm not quite in Aurora, but I'm right next to it, so I don't know how they're doing in Aurora. I just saw one article that Rush Copley had some vaccinations it was offering to more of the 1B group. But otherwise, I haven't seen too much in that. What do you know on 1B and how that's going and where we're at on the vaccinations here in Aurora and the area?
Well, 1B is actually something that just got released just a few weeks ago, and this is our first time ever really doing this amount of vaccines to a large crowd. So it is going to be slow, unfortunately. I'm not happy about it either. I wish we had more vaccines where we can vaccinate everybody as fast as we can. But right now, I know the governor is allowing under 1B the individuals who are disabled, have pre-existing conditions, are 65 and older, who work at a manufacturing company, and other are also educators. So they're the ones that are getting targeted right now for under 1B. The 1A were the essential workers, the healthcare workers. 1C will be a bit more broad between 16 to 64-year-olds and beyond. And of course, there will be retail, restaurants, and other individuals who will be under 1C.
Yeah, I know these categories are sort of can be somewhat confusing. Uh, and I want to say I've looked at the state's got a lot of information, but it's got too many websites. I go to this site to go to that site, and I can figure it out somewhat. but a lot of people maybe couldn't figure all this out on these websites things. And I think it's best. I think the best hope is for the doctor that you go to would be the one who would tell you where to go. I mean, other. So my thought is, how do you think we're going to notify these people or get them online or mailings or door to door or other types of ways to get people? Because not everybody's got a computer.
I agree, and I think that's something that we're trying to figure out. How can we educate people about these vaccines and the accessibility on them as well? I know VNA. I actually received a call, or it was a robocall, letting me know that there is a waiting list available where people can log in or call them and set up an appointment
Well,
if they do qualify.
VNA's
So
got
that,
something. That's good.
yes, so the VNA has something. Other hospitals, I'm not sure how they're doing it. I know the King County Health Department also has an alert system where you can put your email address and they'll send you an email letting you know of all the information of the vaccines coming up.
Yeah, well, I was on their list, I think. I think that's how they got me. But they just told me to look at their site and they had like five or more. It's not, it's increased, but pharmacies. And I want to say, I checked every one on that group and, five or six: CVS, Walgreens, Walmart, Meyer. I'm probably missing someone here, but anyway, I did all these, and the only one that worked out, I mean, it's up in St. Charles, was Meyer. I mean, the other ones, they say they have it, but 25 miles away or like that, or they're not available right now. So I was really, I don't know when this, like I said, I would hope my provider advocate would tell me, and I know that's what's happening there. It looks like the VNA is telling their people that they have the vaccine, but those are not online. I mean, per se. I mean, those type of things. So I don't know. We got a
Yeah,
big education thing here to do, I think.
there's a lot of work to be done. I do agree with that, not only from the state government, but also local governments, to figure out a way of making sure everybody's getting the vaccine as fast as they can, as properly as they can. I think they're coming through a few obstacles that are also a little bit more concerning, such as seniors. Because of seniors' age and their health, how can you get them to a safe place where they can receive the vaccine? So it's a lot of also staff trying to figure out
Oh, right,
how
right,
they're
right.
able to do so. And as we know in King County, the health department has been, I don't want to say cut the programs, but they have been working with a skeleton crew for a numerous years at this point.
Well, I know
And
they
that
got a new interim director. They had the other director left just right before all this came about. I go, wow, it was sort of like, wow.
exactly, and that's another thing additional to the obstacles that unfortunately the director did step down around December. So there's a new interim director that is getting all this workload and trying to do her job as best as possible.
I know it's a very difficult situation and the money things and everything. Well, about the health department, I'll just digress one moment. Many years ago, I was in Aurora. This is like 30 years ago or more. I went in Aurora, and Aurora had a health department at that time. And I went to a restaurant, and it wasn't good. About the extra plate that you're supposed to get when you have a buffet. They were sort of grumpy about it, wouldn't let you have a plate. And I go, no, this isn't right. You're supposed to get a plate a clean plate, because when you put down the food, anyway, it's a health idea. So they got in trouble for it. But then I realized I'm up here in Batavia. Who's watching Batavia? Then we found out the county didn't have a health department, and it was through the state that we were getting watched. And maybe it was I forget who was doing it. It was like really strange. Like maybe the Secretary of State was doing it or something. And we found out that it was really tough to get that health department going. Some people balked at it, and we were about one of the last counties in the area to get a health department. So your thought about the health department is it's been out there for a while, and they haven't been up to it. I mean, they've been doing good here. I'm not gonna, but it's been tough. And I know DePage has had a health department before that, and then Aurora's part in DePage, so they got that blessing, I guess you would say. Um, but that's another question I want to ask you. Do you think Aurora should have a health department? I don't know. Maybe they should. They used to have one. I don't know. This pandemic might serve a need to have a health department in Aurora. I don't know, but a little more coordination, And
Yeah, I know the office for the King County Health Department is located in Aurora. It's on Highland, right next to the what we know Mercy
oh
Hospital.
yeah, yeah, yeah.
Now
I know what
now
you're
I think
talking
it's
about.
Provena or Amita. They always change their name, so it's hard to keep track of it.
Yeah, I know where you're talking about. They do have an office there. Yeah. And so that's an ongoing thing with the health department. Uh, I know certain states and others have been trying to do with to broaden out how we do these vaccinations. Some with churches and other groups and things like that. And is the state is that a county thing would do that, or would a state, or would that be a little combination of both if they start going out to the churches and other? Because I know we're going to need funding here to do these things, the federal
Yeah.
funding too. Well, how do you view this funding for these vaccinations, et cetera?
I would say this would be a joint thing between the state and the local governments. As we've seen with the testing, we do have a few testing provided by the county health department, but also there's a few sites from the state Department of Health. So it's a collaboration of both. When it comes to the vaccines, I think the main concern is where can we have a place that is big enough to
Right.
have all these individuals. Most churches in Aurora that at least I've been able to go visit are a little bit smaller. So you might only be able to have 5 to 10 people
Yeah.
in the room. And remember, we need to be 6 feet apart. The nurses and doctors need enough room, but also keeping the vaccine at negative 95-degree
Oh well,
weather
that's a
is another big obstacle.
well,
So
that's going to have to be some portable freezers or something. I don't know how they're going.
exactly, and that's another thing. Do we have capability of having those to take them all around? I know right now that we do. That's why we get it to the King County Health Department and other locations. However, can we use the same ones for other purposes that might take a whole day of an event for a clinic?
Right, and these, yeah, can we do these things in these locations? And we did some at my church. I want to say my church has a gym, First Press in Aurora, and I know some other churches have gyms, but anyway, they got to be in central locations and everything like that too to really attract. And I just I know the numbers are really low for Hispanic and Black constituents. How are we going to get those numbers up? You got any thoughts on that, Barbara?
I think it's education, of course, but also being able to have the information in English and in Spanish, and make sure that the communities that are needed the most, such as Aurora, can get those information, and we can have those conversations. Right now, most of the items are all in English, and it's not helping the Latino community. But also, there's if we have to discuss about it, there's a mistrust in everything that is going on, because a lot of people have their own thoughts on the process, that it's either happening too quickly, that it's something that the former presidential administration was creating. And at the same time, it's, I think, a cultural thing. I know for the Latino community, it's hard for us to even go to the hospital when we're sick. So now that you possibly had COVID, many of them don't want to admit to that, or don't want to get the the shot because of a fear of that, and also just a stubbornness and cultural background.
Yeah, I know there's a lot of things there, and I'll just we'll move along here. But one thought I just read, I think it was in the patch online the stories, but it said the King County Sheriff was doing some vaccinations at his office and other community law enforcement, and it sounded like only like 50% of the officers were taking the shots. I go, oh no, this is not good. We got to get and this is happening in other places too. I've heard this about in healthcare places that sometimes the healthcare people are not taking the shots as high as we'd like. And I don't know. We just, oh, a sidelight. I, I know President Trump has not taken the shot for some reason. What about our state government people? Are they in line for the shot? Have they taken the shot? Are our government leaders and I will say legislators too? Are they taking the shots? Are they in line, or how is this?
So recently, about a week and a half ago, it was announced by the governor that the state legislator can get the shot if they want to. Many of my colleagues have. I at the moment decided not to, because I feel that my staff and other staff employees and also the minority community should be able to receive it first before me. I'm 28. I would like to consider myself healthy. I try to take the precautions necessary, but I'm also aware of the frustrations that other individuals have that haven't been able to get the vaccine. And I don't want to take a spot for them. So I'm going to wait until the general public can get them
Okay.
theirs.
Okay. Well, I'm just bringing that up for an example. I think the example of a former president is one that's not good. This anti-vaxxing thing is out there, and I know you're not thinking that way, but you're just thinking about priorities, and that's a very good point. That we gotta get. Are teachers in the 1B group now? I forgot now. In Illinois, are they in the 1B?
They are, and they're actually getting their vaccine as we speak. They're the first group of individuals that were allowed to get it as soon as possible. So I know some schools are already setting up days and times that they can have their staff and teachers participate in the vaccine.
So the east and west school districts can get their teachers can get the vaccinations here. And I know that was a big question in Chicago. We've heard about that on TV quite a bit. So I hope that is true that the vaccinations are coming. So I wanted to take on your time that you said you had with us. Anything you wanted to just share with us to close out here about our COVID experience and the vaccinations, Representative Hernandez?
Of course. I think just a few things. If anyone wants to contact me in regards to the vaccine, or if you have any concerns with anything, please feel free to email me at repbarbarahernandez@gmail.com. Follow me on social media as well, on Facebook, Rep Barbara Hernandez, and just give us a call at our office as well, 630-270-1848. Let us know how we can help, not only with what's going on with COVID, but overall, if you have any issues with state agency items, give us a call.
Yeah, well, here's that Facebook. It's Representative Hernandez 83rd. And then I'll put up this other one too on the general website here, State Representative BarbaraHernandez.com. And so, Representative Hernandez, I thank you very much for joining me today. And you can see at the bottom of the screen, if you want your shots with VNA, sign up for those. Give them a call at 630-892-4355. That's not on the shots right now, but I guess they're doing I guess you can call them on that too. I had about the tests here. So anyway, we'll see everybody on Friday. We're going to have a good friend, Uni Camacho, is coming by on Friday. Uni Camacho. She's going to talk about rock study and that program. So I just want to thank Representative Hernandez for joining me for this short time here we had, and we'll hopefully have her back again. We'll have more updates on what's happening here with the vaccinations, and just we got to keep working on these things to get our community vaccinated so we can get more back to, I would call, a more normal here. And we got to get our minority community, got to work on that in every way we can. So I thank her for being with me here today. And God bless. Thank you, Representative Hernandez. And we'll thank her again here. I'll show that here. We'll thank her again. We'll thank her. Well, anyway, it's coming up. So thank Representative Hernandez for being with us here. And there it finally scrolls. It takes a while. It's a slow computer, I guess. But anyway, so we'll see you all soon again. And God bless you all out there. Thank you for listening with me. And bye-bye now. Bye-bye.